The Senior Reset podcast delivers education and resources to help seniors and their families set themselves up for success. Each week, we dive deep with medical professionals and industry leaders to bring you answers to the questions that matter most. From the latest medical advice to financial strategies to staying ahead of scams, we'll build the toolkit you need to thrive. Here's your host, Joel Stewart.
Hey, everybody, and welcome to the Senior Reset Podcast. We are talking about resources, education, solutions, entertainment, and training for the senior community and their families. We have a great setup for you today. I've got my amazing co-host, Nicole Farmer, and I have Joan Ward here. She is the Director of Nursing for Signal Health Group. She's a registered nurse and certified in hospice and palliative care, which is a pretty big deal. That's a hard certification to get. And so she is going to educate us today about hospice and everything we need to know and the myths that are out there surrounding this kind of scary word. Because I think by the time we get done today, we're going to find that it's not so scary. And there's actually a lot of benefits to be had for people who are in certain situations. So thanks for joining us, Joan.
Thanks for having me.
Yeah, thank you, Joan.
So I guess I want to throw you a softball to start out because some people might not even know what hospice is. Can you just talk to us a little bit about what hospice is and why people need to know about it?
Okay. Hospice is a service that's provided to those who have a condition that is basically terminal. They have decided not to pursue any more treatment for that condition that they have, and they just want to live out the rest of their life comfortably. And so it's a team of people. There's a physician, a nurse, social worker, chaplain, and a certified nursing assistant on the team. There are other types of therapies if needed available, but that's the core team, and they come out to the home wherever you live to help provide you with comfort care so that if you have symptoms, they're going to be managed and you're going to not have to run to the doctor every time there's a problem. We come to you in the home and provide the care, and it includes physical care, but also emotional, mentally, all the things you go through, knowing that you're coming to the end of your life. It provides you with the spiritual, social, and the physical. It's not just physical; it's everything. It's the whole person and the family to help them to understand what's happening and help them to get through the process as well.
So I suppose the first myth question I want to ask you here, because it sounds like you already started talking about this, and this just kind of came to me. But in my family, the people that have used hospice, they've always been in a facility. It seems like once people get to a certain point, they get put into a senior care facility, and then hospice is administered at the facility. It sounds like what you're talking about is that hospice can happen in your own home. You don't have to be separated from your family in a facility.
Exactly. Hospice can be wherever you live. If you live at home in your regular house, we come to you there. If you live in a facility, in an assisted living, independent living, we can come to you there. If you live in a nursing skilled facility, hospice can come and care for you there. It's wherever you live, whatever is your home is where it can be provided.
And how does a determination get made that somebody is ready for hospice?
The physician reviews the medical records and looks at the diagnoses, and there may be multiple diagnoses that all kind of create the prognosis. But there has to be a decision that if this disease progresses as expected, this person could have 6 months or less. Not saying that they're going to go in 6 months. Some people live longer. But the main thing is that the problem that they have is not curable. They're not going to get better from it. they can feel better because their symptoms are managed and be comfortable, but the disease is still going to progress and cause them to become worse. And so that just has to be decided, that this is where you're at and in this disease process, and that you're not pursuing any treatment. So if it's something like cancer, as soon as you're done pursuing chemo or anything aggressive, then you can, and you still have the cancer and it's not going to go away, then you can qualify for hospice. You just have to be kind of done with aggressive treatment at that point. And just
now they can still, can I ask a question that comes up sometimes? They can still take medication for some things. It doesn't mean that if they decide they're ready to go hospice, they're just taking them off everything and they're done. Like there are still medications they can take for ongoing illnesses to manage, correct?
Absolutely. The only medications that the medications are reviewed because there are so many medications that are no longer helping anything at this point, like Alzheimer's medications for memory. Well, now people don't know any family member, they don't remember anything. So those medications are likely not of any help, and you're just giving them pills that could cause side effects that they don't need. So you're just looking at what is really not helping, and you're keeping the things that are. And
if they get sick, are they still given antibiotics and things like that if they get a cold or a symptom that way? Because that's just one of the concerns and one of the questions. I mean, I work in home care and we refer people to hospice all the time. And one of the concerns is that they won't be able to have anything. They'll kind of suffer, I guess, through illnesses. But they wouldn't be allowed to have anything that would make them better, I guess, because we're told that they have to stop progressive treatment, right? So I guess that kind of sometimes comes up. They're afraid of that.
Yeah, no, the treatment would be for the disease that's eventually going to take their life. You're going to control the symptoms. But if somebody has a urinary tract infection, a respiratory infection, they're going to get in antibiotics.
Right.
They're going to get whatever they need to be comfortable and help that infection to go away.
Right. Makes sense.
We're not likely to go full bore with IV antibiotics or, IV fluids, things like that. That's a little more aggressive. But that's on a case-by-case basis.
Right. Yeah, thank you. I was wondering.
So if somebody, I guess the next question is, you mentioned that doctor can make that determination, but if a senior is getting older, if their health is really deteriorating, they may not want to talk to their doctor. They may not think that they're as bad as they are. Can the family do something to try to initiate an evaluation, or does the doctor have to make that call?
No, anybody can ask for a hospice evaluation. Family can be the one to call the hospice and say, hey, we think we're at that point. We feel like we might need hospice. Can you come out and do an evaluation? If the patient can self-referral. Then we just go to our medical director and get permission and get the orders to complete the evaluation, and then they're the ones who determine if the patient is appropriate or not. And then we just need medical records to back it up. But anyone can call and say, I think I need hospice.
Okay, and then so just I guess to go over, so if somebody has a deteriorating medical condition, it's not getting better. A doctor says they have 6 months or less probably to live, and they're not aggressively seeking treatment for that condition, no matter what. It's like cancer is a great illustration, but it could be a lot of other medical conditions. When they enter hospice, they're going to be seeing, and especially if doing it at home, it's the home-based thing we're talking about is they're going to have nurses checking on their physical condition. They're going to have people coming in and possibly working with spiritual counselors or volunteers to come to the house. What kind of things do you do during those hospice months to try to make someone's life better? You're not trying to make them physically better, but the whole goal is to make their life better for those last couple months. So
well, we start with the nurse will be out weekly at minimum, and more often if needed. Everything is per patient need. So that will all be determined with the care plan, how often. And you get with the patient, you get with the family, you find out what are their goals for those months that they have. What would they like to be able to do, or what would make them happy? So like, say you have somebody who says, I just want to go to church every Sunday, but I'm so short of breath, I can't make it. Okay, so that would be one of our goals, would be to manage that shortness of breath so that they can get to the church every Sunday and do what they want to do. Just even if it's something that simple. So that's just one example. There's a lot of different things people would like to be able to do, or maybe they're just so exhausted they can't enjoy their day at all. So we're gonna gather all that information and find out what it is that's important to them, that they want to improve, because we can make people more comfortable physically. We can't stop the disease, but we can manage those symptoms along the way. And so that's where the nurse comes in, and she communicates with the physician. The physician doesn't come out, but if they do need a face-to-face, and that's another whole area, but we do that by phone with the physician. But the nurse is constantly in contact with the physician and will get the orders from the medical director and make sure that the patient's needs are met and that the symptoms are managed. And then you have spiritual counselors and social workers for other needs, like maybe they just want someone to talk to about the spiritual side of things. And then the social worker has helps with like things like funeral arrangements, so that you have that stuff figured out and set aside, so you're not trying to decide that at the end. Then the certified nursing assistant, I mean, there's a lot more a social worker does beside that, but that's just one example. And then the certified nursing assistant comes out and provides the personal cares, the bathing, and helps teach the family how to do some of those cares, because they have to be the primary caregiver when we're not there. So we do a lot of educating, a lot of listening, trying to put ourselves in their shoes and see where they're coming from, because not everybody has gone through having someone, at the end of the life, and they don't know what's ahead for them. So we try to get into their world and help them to see what they need, each individual one. It's not like a cookie cutter thing for everyone. The services are all there for everyone, but everybody's needs are going to be different.
Yeah, prior to coming into home care, I thought hospice was a very scary thing. Like, I didn't know much about it. And then I learned a lot more about it. And I think it's great for the patients, but the family side of it, there's so much support there that I think is overlooked and underappreciated probably in the hospice field, is how they're there for the family too.
Yes, because you never want someone to walk away from the situation at the end when the patient passes, feeling like they didn't do enough, or they should have done this, or they should have done that. You want them to feel good about the whole experience, that everything went the way it should, and that they did all they could, because their grief process will be a whole lot easier knowing that they did everything they could do. And so we do our best to try to help them understand that that's what they're doing, and not to have any ill feelings or any guilt, because we can't control.
To have a medical professional in there telling them that, I'm sure has to make a world of difference.
Yeah, that's it's very important.
So, trying to figure out where that 6-month line is, because we've gone over a lot of the different benefits someone can get from getting into hospice. There's extra funding that comes in to try to help make their lives comfortable in a lot of different ways. But figuring out where that 6-week line is can be very difficult. Is there should someone feel nervous about trying to nail that down? Are there benefits to trying to get an early evaluation, maybe get evaluated earlier rather than later?
Well, there is benefits to knowing a little bit sooner, because okay, I guess that's one myth. Is I've had people recently ask me, will this hospice just discharge at the 6-month point? And I was like, no, No, hospice is not. That's just a guide for the physicians, and each diagnoses, there's so many different things we look at that give us indicators of how much time they might have. So we have what we call LCD guidelines that for each disease process, it tells us what to watch for, what to look at, what's happening with this patient. And that kind of gives us an idea that we're in that 6 months realm. But some people might be on for a year and a half, but as long as they're continuing to decline and their condition is worsening, they're still going to qualify for recertification. So we just keep recertifying because they're still continuing to get worse. We're just doing a good job of keeping them comfortable and managing their symptoms. And so sometimes people actually live longer because they are being so well managed. But then at some point, you know, the disease is going to take over.
So what happens? I mean, if you want to get evaluated, is there a cost involved? Like, is there anything negative to try to get evaluated and maybe you're not there yet?
No, I've gone on many evaluations for people that either they weren't quite ready medically, or they're still pursuing treatment, or they feel like it's too soon and they're probably appropriate. They're just nervous about taking that step because of the stigma of that must mean I'm dying. And so then some people just need more time. Sometimes I'll go out and visit people 3 times within a few months just to check in on them until they feel more comfortable. And then they say, okay, I think we're ready now. I mean, it's not something you can rush anybody into. They have to feel good about the decision they're making. But definitely, I think if people had more information and realized that just because you're coming on hospice doesn't mean you only have a few days or a few weeks. I mean, it just means that you get to get comfortable and have a better quality of life for the next six months or longer.
That is the biggest stigma with hospice, is that hospice equals death. And it's just, most people, that's what they hear when you say hospice. Well, I'm not ready to die. Okay,
Yeah.
well, you don't have to. We had a lady on hospice for 2 years. We worked with her on our non-skilled side, and she had hospice come in. We supplemented with waiver services, and she was on it for 2 years.
Yes,
And she was comfortable for those 2 years. Yeah.
Right. She didn't have to go to the doctor. She didn't have to run out for anything. And
medicines were taken care of. Family was given breaks when they needed it. They knew who to call when they needed that support. And you just don't have that with your regular doctors. You can't just call up a doctor's office and they're going to come hold your family's hand while you're, whether your loved one's passing. And hospice does that. I've known several hospice nurses over the years, and my hat is completely off to you, Joan, because you have to have a special heart to do hospice. Like, you just do. And I've known amazing hospice nurses that go out in the middle of the night and hold family members' hands while their patients take their last breath. Our most recent administrator that has since moved on was a hospice nurse forever. And these stories are amazing that they tell.
Yeah, it's I'd probably write a book of a lot of stories.
And it's probably one of those bittersweet, heartwarming, and so hard to carry around with you, but it's such an honor to be able to be there in someone's last moments.
Yeah, I can say I've learned more about life through the process of death and what's important in life and what matters, and that it seems crazy that it's through the end of life, but it really does bring up what's important in life.
Yeah, constant perspective. Yeah. Yeah. Amazing.
So yeah, it's not something I've experienced yet, but I can imagine, even though I don't quite relate. But going back to the evaluation process, if somebody gets evaluated and it turns out that they're not ready for hospice, are there other benefits to the evaluation? Do you find that maybe they're eligible for other services that could make their life better while you're doing the evaluation?
Yes, us with our company having home health hospice and PCA services, we often have PCA hospice needs at the same time, or maybe they're not quite ready for hospice, but they still need some help. And so, we can explain to them that there's a PCA services that can help them in the meantime. And then maybe later down the road, things change and they do need hospice or home health for other skilled problems. So yeah, it's the evaluation isn't going to hurt you one way or the other. It doesn't cost anything. It's just going to educate you more. I mean, I've had patients, I've had to say, no, she's not appropriate. The disease is not that progressed yet. And so maybe in another year or so, or 6 months, have another evaluation. And then, and there's been times when other hospices come along and actually bring that patient on. But I know in my heart, they were not ready. They were not appropriate. And that's not doing justice to somebody who isn't really there yet, and they're being treated like they are. So, that's why you have the evaluation to say yes or no, not, well, you're not, but we're going to take you anyway, because then you're just totally doing a disjustice to that person.
Now, what's the drawback of, say, a hospice company accepting you onto hospice when you're not really ready? Like you're in pretty bad shape, but you maybe have a year and a half left or 2 years, but they take you on anyway. What's kind of the drawback from doing something like that?
Well, if you get someone like that, that's probably a hospice that's not really strong in what they do, and they're not going to treat that person. I mean, they may need treatment for something or medications that hospice doesn't cover. And they'll be treated differently. They'll be treated like they are in their last 6 months, and that, maybe these things that you probably wouldn't need for somebody who has 3 to 6 months, you might need for somebody who has longer. And so taking them off of medications too soon is not a good thing. And, we're very careful about that with hospice. Nicole was asking, are you just going to not give them the antibiotics? Are you not going to give them the med? If they still have high blood pressure, if they still have other issues that are not the ones that are going to take their life, we're going to keep giving them the high blood pressure medication. We're not going to stop, them from getting everything that's managing their symptoms. But if you get a hospice that is going to bring somebody on regardless of whether or not they're appropriate, which should not be happening, but it does, they're not going to be treating them properly. And so they may end up on medications they shouldn't be on yet. And it's just dangerous. It's better.
Well, yeah, the thing I see with it, just sitting back from not even being in hospice and just listening to you talk, one, it's unethical. So that's a whole concern in itself. And then two, you're saying basically they're going to treat them like they have 6 months left to live. So maybe they will cut off some of their progressive treatments or more aggressive treatments that they could still be having, and maybe cause a decline sooner, where they maybe had a year and a half left and now they've cut down their doses and they've treated them like they have 6 months. Maybe they do now.
Right. So you just have to, when you're looking for a hospice, you want to make sure that you ask them, what's making my mother appropriate? Make them tell you why they think they're appropriate. Find out, what is the reason that she's, and what is the benefit of us signing her on to hospice? See if they can tell you. If they can't tell you, then you probably have the wrong people.
Honestly, Joan, I love that I learn something every time we do these podcasts still. I've been doing home care for 15 years in this medical field, and I learned something every time. I honestly had no idea there were hospice agencies out there that would admit someone that wasn't appropriate. Like, I didn't know that was a thing. Now I know, like, home care sometimes will admit when they can't staff, or, maybe make them, they're not appropriate for home care, but I didn't know that someone would just come along just to pick up a number and be like, cool, I'll take you on, and maybe completely change the course of someone's life. Well, that's scary.
Hopefully there's not very many, but I have heard stories up from people who have gone through that. And
It's something
like,
to be aware of.
yeah, and like in that one situation, I actually told the family she's not appropriate, and then I found out later somebody else came along and swooped him up and brought him on service. And so I actually spoke with the son and told him what to watch for, because I was appalled that they would do that. But
absolutely.
I hope it doesn't happen very often, but it does happen.
No, but for our family members that are listening that have loved ones, for me that could have to face it one day, Joel, we have, parent, like, that's good to know that you do have to watch out for those things, because I would never have imagined that someone would take someone on a hospice case like that wasn't ready. That's crazy to me.
Right. And you don't want, there's a lot of hospices out in this part of the world where I am in Las Vegas. There's a lot of hospices. So there's a lot of competition for the business, which is sad to say. So there's a lot of choices, and people don't always know they have choices. They can choose who they want. And that's what they need to do. They need to compare. They need to actually ask questions, find out, why are you saying this, that this is the right thing for my loved one? And see if they know what they're talking about. And, don't just get somebody who says, oh, well, you'll get supplies, you'll get this, you'll get that, and they're not really talking about the disease process. So if they don't understand.
Well, and that's the truth. My aunt passed away last year, and she was at a place where she could have probably used hospice, but she was still fighting. She was actively dying in the hospital, and it was just a matter of time, but she was not ready to accept that. She wanted life-saving measures. She didn't want to be a DNR, but they brought hospice in anyway. Well, my family waited for me to get there because of just my background. And so I'm asking questions, and I'm asking the regular nurse, and she tells me I have to wait for the hospice nurse. So the hospice nurse comes in, and I'm asking all these questions, and she has no answers for me. Like, what medications will you be stopping? What can we expect? What are you going to be doing for her? And she was like, pretty much told me she didn't have any of the answers. And I'm like, but I've been waiting for like an hour. It was just a horrible experience. We did not sign on with hospice. We just waited it out.
Right.
But it was awful.
And that's what makes me sad, because I think there's probably more of those situations. And so when somebody could actually have a good hospice experience with a different company, maybe, and then those are the examples that they think, oh gosh, they're all that way. But
there was kind of a comparison made of like a euthanasia kind of thing about end of life, and the way that it was worded and the way that it was said should have never been discussed like about a family member. It was just an awful experience.
Yeah, and that makes me sad. That's why I say people should not be afraid to ask questions. And if they don't have the answers, then they're probably the wrong company, and you want to try
exactly
some others.
Yeah.
So I want to ask on the funding side. We talked about how someone can enroll in hospice, and the goal is 6 months, but they could roll out of hospice if a new treatment comes available that they might want. Or if their conditions just start to improve for whatever reason, maybe they take off some weight and they start feeling better, whatever it is, they can roll out, after they're involved, and they can roll back in at a future date. And you said that there are people that have been on for, a year, 2 years. How does the funding work for hospice when you start extending past that 6-month mark that it's intended for?
Well, it's mainly Medicare. Most people have Medicare. If they're under the age of Medicare, then they might have a regular insurance, which covers it. But it goes by certification periods, and there's 2 90-day cert periods, and then there's 60-day periods indefinitely after that. And each of those, at the end of each of those periods, is when you recertify for the next cert period. As time goes by, the cost, or the payment, I should say, gets a little bit less for when someone's on for a longer period of time. Medicare still pays, but it gets less. But the thing is, you can come off anytime you want. If you change your mind and say, okay, I want to revoke, this isn't for me, I want to seek aggressive treatment, you can sign a paper and be off service right then, right now. And then in say 2 months later, you want to get back on again, and you're still qualified, then you go into the next cert period. You lose the rest of that certification period and go on to the next one. And then there's also times when patients improve, because sometimes we're not, we don't have a crystal ball. We're not perfect. We think they're ready for hospice, and then we actually get them so managed, and they start to improve, and we can't show that there's any more decline, and so then we have to sign them off service for temporarily, and then eventually we get them back later, because the disease is progressing much slower than expected. So those are those other cases where hospice has to sign them off, and then they're available to come back later once they're approved again.
So if they discharge in the middle,
sorry, go ahead, Nicole.
It's probably the same question.
No.
So if they discharge in the middle of a cert period, like in the middle of 45 days into a 90-day period, they lose 45 days that you're going to get paid for, right?
Yeah, well, we're not going to get paid anyway, because they're going to come off. But when they go to sign on again, they have to go into the next cert period. So
that 45 days just disappears.
Yeah, it does. And
so my question is, so if a hospice, like say you'd mentioned that you evaluated somebody, thought they weren't ready, and then another hospice gave them a second opinion and said, yeah, we'll take you on and give you services. If they're not really ready, it sounds like the funding is the first 6 months, you have the most funding for medications and social services and all kinds of things that can make your life better. After that 6 months, you start getting less and less and less. So if somebody takes you on too early, say you're like a year, 2 years, 3 years too early, which it's really hard to tell sometimes. It's they could end up, when they need the most funding, the funding's not there anymore. And that's kind of the risk of getting into a hospice too early, or a hospice taking somebody on. That's one of the risks.
Well, that's true. And I've seen that. I was approached to take a patient that had been on hospice for 5 years, which I'd never heard of that. And then suddenly they decided they were going to take them off service. Well, at that point, they probably weren't getting paid. I don't know exactly, but probably not getting much, pretty much free service, which they should have been obligated to if they kept them that long. Because now the patient was probably at a point where they were actually appropriate for hospice. 5 years ago, obviously, they were not. And so it's a disservice to that patient, because now their benefit is used up. Other hospices can't take them because, it's basically free care. But, a big hospice could do it, because, it doesn't hurt to do pro bono once in a while and help somebody out. I mean, that's what all should do on occasion. But, it was a situation that could have been avoided had they not taken her on so soon.
Yeah.
And I don't know the story behind it. I just know the situation was that they had been on 5 years, and I've never heard of anyone being on that long.
No, me either.
So I guess one of the myths out there is that, you're kind of stuck with the hospice agency that reaches out. If you're in a hospital and the hospital says you need hospice and their hospice nurse comes down, one of the myths might be that you have to, talk to that hospice nurse, and you certainly can. But it sounds like you can also get a second opinion and ask questions and decide if you're comfortable, because it sounds like not all hospice agencies are created equal. So what are some questions that people could ask to try to figure out if they are talking with a good hospice or whether they need another opinion?
Well, I think they kind of have to go with their gut in the beginning and see if they feel like they can talk to this person. Are they rushing them? Are they trying to hurry up and get them to sign on the dotted line? Are they taking the time to explain everything that you're asking them? And most of the time you're getting a marketer. It might be an RN, it could be a nurse or an LPN, it could be a nurse liaison, but it might not be. It might be nobody medical, just a marketer that has been trained on hospice, but they're not going to have medical answers for you. So I think to speak to one of the nurses so that you have an idea who's the people that are going to actually be coming out? Who's going to be doing the care? Am I going to get the same nurse every time? Am I going to have someone different every time? Is somebody going to be available in the middle of the night when I need help? You know, those are all important things because those are what the services are supposed to provide. The continuity of care is huge for a hospice patient. You want to be connected to they start to feel like we're part of their family. So if they're getting a different person every week, the care isn't going to be what it should be.
Are there places where people can find reviews for hospice organizations? Like if they go to Google and look them up, are they going to be able to see reviews from family members?
Some of them, yeah, some of them are on reviews. That's one way. But I think you just have to ask more questions and compare. Like I had to go, I had to go out on an evaluation for a patient that was in a facility in an assisted living. The daughter said, I'm tired of speaking to the marketers. I want to talk to the nurses. So they set her up with 4 of us from 4 different companies to talk with her to find out who she felt most comfortable with. They did choose me. So I ended up getting that patient, and she still texts me periodically, and that was 5-6 years ago. So people don't forget, you know, they remember those that took care of their loved ones. And but that was the way she went about it. And I said, wow, that's pretty cool. I've never had anyone do that, where they, you know, talk to 4 different nurses from 4 different companies, and then they could actually make the decision who they wanted, based on who's, you know, going to be coming out and actually taking care of the patient. And you do have choices. And I think that gets misconstrued when they're in a hospital, because the hospital has certain people that come in and they're supposed to give you at least 3 options, but you might live in an area where you have a whole lot more than that to pick from, and you don't have to choose from those 3 either. So you just have to shop around and know that you have options.
That is the biggest, most important thing to educate on, I believe, across the board, is choice. I mean, so many times they get put in the hospital and they just get all this paperwork thrown at them. And it's happened so many times to family members of mine and friends that I know. I had a friend, he's a service coordinator here in one of the independent livings. I've worked with him for years. His mom wanted our home care agency at Signal, and they sent, they came in and gave her paperwork, and they were like, okay, we have you all set up with the hospital company, have fun, you know, send her home. And he's like, wait a minute, like, we want Signal. And so he was there and was able to advocate and speak up for her. But so many people, they get discharged and they're like, well, I don't know. They said somebody's coming out. I don't know. I mean, they're just told what to do. So letting them know they have that choice. I try so hard to educate before they get to that point for my side of things.
And if you get somebody and you're not happy, you can transfer. You can transfer to another company. You're never stuck. It's always an option.
So how does someone do that? I mean, I guess following up on that is, how do you know if you're stuck with a bad hospice provider? And if you realize you are, how do you go about the process of changing a hospice? Is it as simple as, you know, interviewing another hospice and saying, you know what, I want to go with you guys, and then they handle the paperwork? How does that work?
Pretty much, if you're uncomfortable and you're feeling like you're not getting what you're supposed to get, or they're not showing up, or, you know, for whatever reason, when I, you know, say I call and I say I need help because something happened with my grandpa, and they're like acting like, you know, oh, they're a bother, you know, and they're feeling like nobody wants to follow through and be there for them, or, you know, they're not getting consistent care from the same people, whatever it is that makes them uncomfortable, then they have the right to look elsewhere. And you just call another hospice and say, I'm getting hospice care right now with this company. I'm not happy. Would you come out and talk to us and see what you think? And then you, of course, do the same process. You still have to look at the medical record and make sure that they're appropriate, because just because someone else brought them on doesn't mean they're appropriate. So you still have to do your due diligence and make sure that they're right for hospice. because who knows, maybe that's why they're complaining. Maybe they're not really a hospice patient, but that's an easy thing to do. And then it's just a matter of paperwork and having them sign, and then you notify the other hospice that they're transferring, and get their records, and you just come together and it switches over. It's very easy for the patient. The equipment gets switched over because we provide hospital beds and different things. So then that would get switched over as well to the company that, you know, the new hospice is taking on. So all of that can be coordinated. It's not difficult.
And a good hospice agency would be the one to coordinate those things for you, correct?
Yep. Yeah, they usually will give you time. The other hospice won't just pull it out from under you and leave you on the floor. You know, they're going to give you time to get another bed in there and switch the patient over. And so, you know, you're never stuck unless you live in a very, very small town and there's no other company. Then I guess you're, you know, don't have as many options.
Did you have anything that you might want to say to family members out there that are looking, you know, they're realizing maybe that their family member might need hospice? Do you have any words for them before we wrap up today?
Let's see. Yes. I just think you have to be comfortable with the decision that you make, and not to be afraid to ask a lot of questions. There is no bad questions. You need to feel good about what you're doing. And then once you make that decision, our goal is always to help everyone, not just the patient, but the family, the caregivers, the friends, whoever's taking care of them, to all feel confident about their role, and that we are in there providing that support for all of them. Even the neighbor across the street who comes in and checks in once in a while. Anybody that's involved and cares about that patient, you want them to feel supported. So that's something you should be getting. We want the patient to ultimately have a dignified and peaceful passing, and the family to feel good about it, because you can have a positive experience in the most difficult time of your life. And losing someone is so difficult, but you can walk away from it and know that it went well and they went peacefully and you did your part, and then your grief process is going to be so much smoother. And also, things go the way they're supposed to. You can't control everything. I've had people wait in the room for days and say, I can't leave them, I can't leave them. And then I tell them, well, they might be waiting for you to leave, you know. And then one day they get up, they go in the kitchen for something, they come back and the patient's gone. And they say, oh, I've been waiting all this time, and now, well, that's how it was supposed to be. So, you know, we just don't get to control everything. And the patient might leave on their own because they feel like it's too hard for the loved one to go through, or for whatever reason, they just felt like they needed to be by themselves when they exited the world. But just know that everything goes the way it's supposed to, and we don't have as much control over things as we think we have. And it's okay for it to not be perfect, but as long as the patient goes peacefully and comfortably, however that ends up being, it's all right. You don't have to feel like you didn't do something right. That's the thing. And then after hospice, there's bereavement support. So you have a whole year of support if needed, to help you through the grief process. And some people use it and some people don't. I would recommend you at least look into it and see if there's anything that would help, because there's different ways they can help. So I guess that's about all I can say. Is we just want people to feel good about the way it went, have no regrets.
So
I think you're amazing, Joan.
I do too. It's a special type of person that can help families with this.
Absolutely.
I guess to try to summarize a lot of the things that we talked about today. We first started talking about what hospice was, that it is, ideally helping someone in their estimated last 6 months of life, but that it doesn't have to be the last 6 months. I mean, that's kind of what our goal is, and that's where the most funding is, so that if to make sure that you're the most comfortable during that period. But you can, if a new treatment comes out for you, or if you start to feel better now that you're more managed for the pain and with the care you've been getting, that you can go off of hospice and get that treatment. And if it's not working out, you can always come back later. We talked about that there's really some benefits if you want to get evaluated early, because it might give you a better idea of when that window might be coming up. But it might also, you might find that you are eligible for other services, other therapies, personal care assistant, or different benefits that you might not have known that were going to be available to you, that might be available, that you might find out about during the evaluation. We talked about a little bit about how the funding works, about how you get the most in the beginning, and it starts titrating down as time goes on, and that some hospice agencies may take you on and early to try to get the most out of a client, and how that may be a good disservice to you, and that you should talk to, get a second opinion or a third opinion if you need it, and really make sure that you're comfortable with the company that you go with, and make sure that you're the priority, and not just trying to access the funding. And that when you do get into hospice, there's some huge benefits as far as the care that you receive, and the medications, and the having nurses in there on at least a weekly basis taking care of you. And then we talked a bit about, from the family side, about how things kind of happen the way they're going to happen. Don't feel guilt about it. All you can do is your best. Does that sound like a pretty good kind of overview of what we discussed?
I think so.
All right.
Well, it's a huge subject. It's a huge subject.
It is a huge subject, and maybe we'll have you back on again someday. To delve a little deeper.
It could go very in depth, but I think overall that's, and then if people leave questions, we can always answer questions.
Yeah. So you're located in Nevada. If somebody wanted to reach out to you to discuss, so you're in Las Vegas. How could somebody reach you if they were looking to talk with you a bit about hospice for their family, and they're in the Las Vegas, Nevada area?
Well, with our where our website has our phone numbers and all our information to reach out to us.
Okay, we'll make sure that gets put in the show notes, and people can reach out to you if they're in that area.
Because I do have often people call me from out of town, and they'll say, my grandmother lives there in town, we're not sure what she needs. And then I say, well, I'll go out and talk to her. And, so I'll just make a visit out just to pop in and see if they're even somewhat close to needing hospice. But even if they don't, it gives the family a great relief to know that somebody poked their head in and checked on them. And now they have an idea what they need to do for them to help them out. And so we're happy to do things like that. We don't have any problem making a trip over to somebody's house to see if, our services might help them. And if that's not what they need, we can help advise on what they might need. And then the family has a little bit of, they can relax a little, because a lot of people live in Vegas but don't have family here. So
you really are a saint. All right. Well, thank you for coming on. I appreciate it.
Thank you.
Thank you, Joan.
You've been listening to the Senior Reset podcast. If you found today's episode helpful, please consider sharing with the seniors in your life, so they too can live stronger, healthier, and more connected lives. Find all our episodes or submit your questions at signalhg.com/podcast. This podcast is intended for informational use and not as a replacement for medical diagnosis or care.